Do you know the top 10 signs of bowel cancer? Bowel cancer, often lurking in the shadows, is a silent predator that preys on the unguarded. It's a malicious disease that attacks the large intestine, a vital part of our digestive system. Recognizing the signs early can literally mean the difference between life and death. So today, arm yourself with knowledge and take control of your health. It's time to shed light on this shadowy menace. Now we'll delve into the top 10 signs of bowel cancer. At number 10, we have fatigue. Now, we're not talking about the usual tiredness that follows a long day or a poor night's sleep. This is a persistent, relentless fatigue that seems out of proportion to your activities, and it doesn't improve with rest. Bowel cancer can cause fatigue in a couple of ways. Firstly, it can lead to loss of blood, which can cause anemia, a lack of red blood cells. These cells are responsible for carrying oxygen around your body, so when you don't have enough, it can leave you feeling worn out. Secondly, cancer cells use up a lot of the body's energy supply, which can also lead to fatigue. It's important to remember that fatigue is common and often linked to many conditions, not just bowel cancer. But if you're experiencing unexplained ongoing fatigue, it's certainly worth noting. So, if you're feeling unusually tired all the time, it's worth getting checked out. Coming in at number 9 is abdominal pain. A common but often overlooked symptom of bowel cancer is a persistent pain or discomfort in the abdomen. This isn't your typical tummy ache that goes away after a good night's sleep. We're talking about a continuous, nagging pain that just doesn't seem to let up. Often, this pain is linked to changes in bowel movements or eating habits. It might feel like a cramp or a general sense of discomfort. Sometimes it may even be associated with bloating or a feeling of fullness in the abdomen. It's important to remember that abdominal pain can be caused by many conditions, not just bowel cancer. However, if the pain is persistent and doesn't go away, or if it's accompanied by other signs we're discussing in this series, it's definitely a good idea to consult your healthcare provider. Don't ignore persistent abdominal pain. It might be more than just a stomach ache. Number 8 on our list is unintentional weight loss. You might be surprised to hear that sudden, unexplained weight loss can sometimes be a sign of bowel cancer. It's not about losing a pound or two after a rigorous gym session. We're talking about significant weight loss that happens without any changes to your diet or exercise routine. Here's the deal. Bowel cancer can disrupt the normal functioning of your digestive system. This disruption can affect your body's ability to absorb nutrients from the food you eat, leading to weight loss. Furthermore, cancer cells use up a lot of the body's energy supply, which can also contribute to weight loss. It's crucial to keep an eye on your weight and note any drastic changes. Remember, we're not talking about intentional weight loss from dieting or exercising. We're talking about weight loss that occurs without any apparent reason. If you're dropping pounds without trying, it's time to consult your doctor. At number 7, we have constipation or diarrhea. Now, this might sound like two opposite ends of the spectrum, but it's all about the disruption of your normal bowel habits. Bowel cancer can cause changes in your bowel movements. This could mean you're experiencing constipation one week and then diarrhea the next. It's the inconsistency that's key here. Sometimes, the cancerous growth in your bowel can block the passage of waste, leading to constipation. On the other hand, your body might try to rid itself of the offending growth by speeding up bowel movements, resulting in diarrhea. It's crucial to note any changes in your bowel habits over time. If you find that your visits to the loo are becoming more frequent or less so, or if the consistency of your waste has changed significantly, it's time to take note. Remember, persistent changes in your bowel habits warrant a visit to the doctor. Let's not take any chances when it comes to our health. Sign number 6 is blood in stools. It's a clear and troubling signal that should never be overlooked. But how does bowel cancer result in this alarming symptom? Let's break it down. The cancerous growth in the bowel can cause it to bleed. This blood can mix with your stools, turning them a darker color, sometimes even black. Alternatively, you might see bright red blood after a bowel movement. Now, it's important to note that blood in your stools doesn't automatically mean you have bowel cancer. Other conditions, such as hemorrhoids, can also cause this symptom. However, it's a significant change that needs to be reported to a healthcare professional. They can conduct the necessary tests to determine the cause and put your mind at ease. Remember, early detection of bowel cancer significantly increases the chance of successful treatment. So, never ignore blood in your stools. It's a sign that something isn't right. Halfway through our list at number 5 is the feeling of incomplete evacuation. This is a sensation you might experience after a bowel movement. You might feel as though you haven't fully emptied your bowels, even if you've just been to the loo. It's a strange feeling, isn't it? Bowel cancer can often cause changes in your body's usual processes, and this includes your bowel habits. The growth of a tumor in your bowel can interfere with the normal passage of waste, leading to this peculiar sensation. It's something that might be easy to brush off as just a bit of discomfort, but it's crucial to note this unusual feeling. Remember, cancer often shows itself through persistent changes. If you're frequently experiencing this sensation of incomplete evacuation, it's not something to ignore. It could be a sign of something more serious. If you consistently feel like you haven't fully emptied your bowels, it's time to get checked. Number 4 on our list is change in stool shape. Now, this might not be a topic we generally talk about at the dinner table, but it's important to be aware of it. Bowel cancer can cause noticeable alterations in the shape of your stools. Typically, stools are long and sausage-like. However, if you start to notice a consistent change, such as stools becoming narrower or ribbon-like, it's something to keep an eye on. Bowel cancer can cause a tumor to form in the bowel, which may narrow the passage, altering the shape of what passes through. It's crucial to remember that these changes don't always mean cancer. Many other conditions, such as irritable bowel syndrome, can also cause changes in stool shape. But here's the takeaway. If you observe a persistent change in your stool shape, it's worth discussing with a healthcare professional. It could be nothing, but it's always better to err on the side of caution. A consistent change in your stool shape is a sign you should not ignore. Coming in at number 3 is loss of appetite. Now, this might seem like a common symptom for many illnesses, but when it comes to bowel cancer, it plays a significant role. Cancerous cells in the bowel can disrupt the normal digestive process. As the body works harder to fight off these cells, you may find yourself lacking the desire to eat. This disruption can lead to a feeling of fullness or bloating, even when you've eaten little or nothing at all. It's important to pay attention to this, as a sustained loss of appetite can lead to unintentional weight loss, another key sign of bowel cancer. What's crucial here is to understand that while missing a meal or two won't raise any alarms, a persistent change in your eating habits might. So, if you or someone you know is experiencing a sudden, unexplained loss of appetite, it's worth taking note. A sudden loss of appetite could be a warning sign of bowel cancer. Our second sign is nausea or vomiting. You might wonder, how does bowel cancer cause nausea or vomiting? Well, it's a rather indirect effect. When a tumor grows in the bowel, it can partially or fully block the passage. This blockage disrupts the normal flow of digested food and waste, which can lead to feelings of nausea or even cause vomiting. Now, it's important to note that occasional nausea or vomiting can occur due to many reasons, from food poisoning to a stomach virus. However, if you find yourself feeling nauseous or vomiting regularly without a clear cause, it's time to take notice. Bowel cancer is not the only condition that can cause these symptoms, but they're definitely not something to brush off. In fact, persistent and unexplained nausea or vomiting can be signs of various serious health conditions, including bowel cancer. Persistent nausea or vomiting is not normal and should be checked out. And the number 1 sign of bowel cancer is anemia. Now, you might be wondering, what's the connection between anemia and bowel cancer? Well, bowel cancer often results in bleeding in your digestive tract. This bleeding isn't always noticeable in your stool, and you may not even realize it's happening. Over time, this internal bleeding can lead to a shortage of red blood cells, which is exactly what anemia is. So, what does anemia feel like? Well, it can cause a range of symptoms. You might feel tired all the time, or find yourself short of breath even after minimal physical exertion. Your skin might look paler than usual, and you could experience headaches, dizziness, or a fast heartbeat. Now, remember, anemia itself is not a disease, but a symptom. It's a sign that something else, possibly bowel cancer, could be going on in your body. Anemia, especially when coupled with other symptoms, could be a sign of bowel cancer. So there you have it, the top 10 signs of bowel cancer. A quick recap: we've got fatigue, abdominal pain, unintentional weight loss, constipation or diarrhea, blood in stools, a feeling of incomplete evacuation, changes in stool shape, loss of appetite, nausea or vomiting, and anemia. These signs are not to be taken lightly. Regular checkups and vigilance can help in early detection, potentially saving lives. Remember, early detection is key, and these symptoms are your body's way of raising the alarm. Don't ignore them.